My name is Dr. Karen Horridge and I'm a paediatrician working with disabled children and young people in Sunderland in North East England. I'm going to spend a moment or two talking and helping us to think about constipation. This is really important because it can affect all of us, but it's much commoner in people with a learning disability. And in people with a learning disability, the risk is of not recognising it, that it can become really serious and cause complications, even rupture of the bowel, and can even cause death. So we need to know what we're looking for when we're looking out for signs of constipation. First sign of constipation, too few poos. This means not going for a poo very often. Not for 3 days or more, or less than 3 times in a week. Second sign of constipation, it's hard to poo. So that means having to heave and strain to shift the poo out. And there may be pain when trying to pass a poo. The person might hold back or strain to try and stop passing the poo to try and avoid that horrible, painful feeling. And there may be a feeling of not emptying properly after going for a poo. Third sign of constipation, the poo looks all wrong. It may be absolutely huge and even block the toilet. Or it may be small, dry and hard, like rabbit droppings. It may be runny and smelly, like overflow round a blockage that then stains clothing or pads. There may even be blood passed with the poo or on wiping afterwards. Fourth sign of constipation, foul smells. Very foul smelling poos or very foul smelling wind and lots of smelly wind. This is because everything's been all jammed up for a long time and has got all fermented with bad bacteria. Fifth sign of constipation is how it makes you feel. Those people who are able to tell us how they feel tell us they have bloated tummies that are crampy and painful. It puts us off our food and gives us a poor appetite. We might have low energy levels. We might be generally unhappy, irritable, angry, or just not well. If we think a child or young person is constipated, what can we do about it? We need to increase clear fluid intake, which helps keep things much softer and easier to move along and pass. Increasing fibre in the diet, such as fresh fruit and vegetables, bran or oats, helps things move along and gets the tone in the bowel wall back from being like an overblown balloon to nice and squeezy and moving things along properly. More exercise is always helpful if this is possible. For those who are able to use the toilet, having a regular private time with enough time, best after meals when our body's natural reflexes will help us move things along. Sometimes we might need a stool for our feet to get in a better position to shift the poos along. If we're worried about constipation and if the simple measures aren't working, then we need to see our family doctor for assessment and advice. We may need to have medicines to help to make the poos soft enough to pass more easily or to push the poos along and out. Constipation, really important. There's simple things we can all do to pick it up early, to prevent it from getting more difficult and to get help when we need it. Thank you for listening.